There's a lot of stigma associated with weight loss surgery, and there's a lot of perception that it is the easy way out for patients, when in actual fact, often by the time patients come to see us, they have tried almost every diet under the sun, have tried weight loss medications, they've tried every exercise program, and they're really trying to find a long-term solution to their issues. I think the main thing I want patients to know is that anything they're feeling, anything they're going through, can almost guarantee that we have seen patients exactly like you, and we've been able to help them. Hi, I'm Dr. Carla Gillespie. I'm an upper gastrointestinal and bariatric surgeon, and I specialise in weight loss surgery as well as reflux surgery and cancer of the esophagus and stomach. I consult at the Integrated Health Institute on George Street in the city, and I operate at East Sydney Private Hospital. So obesity is a chronic or a long-term problem, and as such we need to have a long-term solution for these patients. Things like yo-yo dieting and even medications are only as effective when you're actually on these diets or on these medications. And I think that's why some patients get really sick of being on these fad diets, and they find that once they're in this starvation mode from being on a diet, it means that their body signalling is different. They get more hungry, they're not as satiated with the food they're eating, and to make matters worse, their body's flicking into a lower metabolism, and so they're finding it very hard to continue to lose weight. Obesity surgery works because it interferes with that gut-brain axis, and it means that we can provide a chronic or a long-term solution to these patients' problems. There's been new guidelines released last year from the International Federation for Surgery for Obesity and Metabolic Disorders. So they've actually extended the criteria for patients who are eligible for weight loss surgery. So it now means that anyone with a BMI above 35, regardless of comorbidities, or those with BMI above 30 with metabolic issues, can be considered for weight loss surgery. There are other things we have to take into account. For example, you can't be planning a pregnancy within the 12 months following surgery, and you can't have any untreated disorders such as psychological problems or alcoholism, which may affect your long-term results. Weight loss surgery is very effective for treating type 2 diabetes, and interestingly enough, it seems to be independent of the actual weight loss, because in the days to weeks following surgery, when the patients haven't actually lost a large amount of weight yet, we find that we're able to rapidly decrease a lot of the medications they're on. It's a very effective long-term treatment for treating or even curing type 2 diabetes, and we have found that up to 60% of patients can come off all of their diabetic medications after weight loss surgery. Weight in itself is not genetic. More often than not, it's a combination of genetic and environmental factors that mean that one person may be more predisposed to putting on or retaining weight than others. So this may mean that in two individuals who have the same exercise and same diet, one may be putting on weight or not being able to lose weight where the other may be able to. So it's really important not to put blame on patients when we're all coming from a different starting point. Definitely agree that about the body positivity movement, and I definitely agree that we should not be putting stigma on patients who are suffering from obesity, but I think we also need to look into the health consequences of obesity and the significant life changes that we can help these patients with if they do manage to lose weight. There are a lot of comorbidities that come along with obesity, and often many patients who have previously thought they haven't had any issues, once we actually take their observations, check their blood results, there often are some metabolic consequences of their weight, even if they feel they are relatively well and healthy when they come into the rooms. I think the interesting thing about when patients come to see after weight loss surgery is it's often not the number they're focusing on, it's all of these non-scale victories that we like to talk about. Often it's being able to run around the park with their children, or being able to mobilise and walk without joint pain. It's being able to come off their medications, which are previously quite expensive and quite onerous to be taking. There's all of these non-scale victories that I think patients really celebrate more so than the number that they see on the scales. I think my most memorable weight loss patient was someone who had booked in for surgery and unfortunately had to be cancelled due to COVID. They were very distressed. They really found they were at breaking point with how obesity was affecting their life. It wasn't just the musculoskeletal problems that they were suffering, for example, not even being able to mobilise around the house without issues and pain, but it was really affecting interpersonal relationships, especially with their partner. And I think that once we went through the weight loss journey and saw the patient in rooms, she was so thankful and happy that she'd gone through the process. Every kind of facet of her life was changed because of being able to lose some weight and really re-engage in her life again. The main health consequences from obesity are generally the metabolic consequences that we talk about. So, for example, type 2 diabetes is very common, and up to 80% of patients who do have type 2 diabetes are generally obese. There are a lot of issues with cardiovascular effects of obesity, for example, increased risk of ischemic heart disease, problems with lipid or cholesterol metabolism, there's increased risk of stroke. There's also a lot of mechanical problems, so patients often will be suffering from sleep apnea, and often that's something their partner notices. They often get a lot of joint pain from osteoarthritis. And for women especially, obesity can lead to a lot of reproductive issues, and so fertility can be definitely affected by obesity. This can lead to cycles where patients don't ovulate and even uneven cycles as well. And so losing a small amount of weight can really benefit all of these issues that are associated with obesity. Even up to 5 to 10 kilos is associated with positive effects in most areas.